Welcome back. If you have health questions, our Doctor on Call has answers. And we welcome back UK emergency physician Dr. Ryan Stanton, who continues to answer your questions that are submitted through our website. We're getting questions now on Facebook, your emergency medicine page, all over the place. So lots of good topics to get to today. Our first question comes from Haley, and she says, my head feels heavy and cloudy. Mainly it feels like my ears need to pop, like when on a plane or driving in the mountains, but they won't. And she wonders, is this an allergy or a cold or what's going on with this?
Well, if you're here in Kentucky, it's probably allergies. Almost 100% of people up here have some sort of allergy. And usually this head fullness is from our ears. Our ears do a lot more than just hear. They're responsible for the hearing, but they're also responsible for our balance. The main thing that keeps us upright and allows us to know, our brains to know where we are. And so what she's feeling is this differential pressure in the ears. There's a tube that runs from the ear actually into your nose called the eustachian tube. That's very important in actually balancing that pressure, and it's why when you're in an airplane or you're in a car and go up altitude really quickly, you feel like your ears need to pop. That's pressure building up, and when you yawn or chew on gum, that's opening up that tube to allow that pressure to equalize. If it doesn't equalize, that pressure in there, one, can confuse your ears, and if they're not equal, will make you feel dizzy, or if it stays built up in there, can actually make it feel like you can't hear or that your head is stuffy, like you have pillows over ears. So one thing with allergies, that tissue in there gets inflamed and blocks up those tubes and makes it difficult to drain. That's why a lot of the treatments are there to get that inflammation down and allow those ears to equalize. So what she's talking about is that difference in pressures between the inside of the ear and the environment around us.
Interesting. Our next question is very common among parents. I think I've even called you a few times myself to ask about my kids. This question comes from Megan. She posted it on our website. At what temperature do I have to worry about my kids' fever? This is a big one.
Well, this is kind of the big keystone of urban, not necessarily urban legends, but wives' tales, that if the child's fever gets too high, their brain's going to boil. That's not true. First, what I worry about more as an emergency physician is the way the child's acting, not necessarily the elevation of the temperature. Temperature has a very important role in children's health. It's the equivalent if you're having a party at my house and I don't want you there, I come in and I turn up the temperature. The temperature gets really hot, everybody's going to leave really quick. Well, that's what the body's doing, is making your body uncomfortable for those germs. And so there's some very important things that's trying to do, and that's to get rid of those germs. Things we do worry about: a fever in children less than 2 to 4 months of age. This is when children don't have a very strong immune system and before their first set of immunizations at 2 months. So less than 2 months is when I really worry as an emergency physician. The child is lethargic. I think this is the number one, when the kid is not looking right. When I walk into a room and see a patient, that's what I look for right away, and that's what gets me worried, is if a child is lethargic and not acting like a kid. Child has signs of dehydration. Usually this is associated with nausea and vomiting, lasting more than a few days. Anything lasting more than a few days needs to be checked by a primary care physician. And febrile seizures, which happen in some children, usually not too dangerous, but can be very frightening to the family. So the important thing when we see a fever, if your child gets a fever, is give a little medicine, Tylenol or ibuprofen, to try to get it down. If that gets it down and they're acting normally, you can watch it. Any concerns at all, call your doctor, or especially if they're lethargic or in the middle of the night when your doctor is in their clinic coming in to see us, maybe something you need to do.
Well, very important notes there. Thank you, as always, for being with us. And you can always submit your questions in the Doctor on Call section of our website. You'll find that in the drop-down tab under Health. And you can also see previous answers to questions that you've submitted in the past weeks. Thanks again. We'll be right back with a check of your forecast. Not really a fever, but it's heating up outside for sure. Meteorologist Mary Wasson has those details up next.